Is Colorectal Cancer Awareness Month, and colorectal cancer is the second leading cause of cancer death, second only to lung cancer. But what's really important is getting screened, knowing where you are, knowing your health, going to your general practitioners.
Hello, I'm Tom Mazza. I'm a colorectal surgeon at Lexington Medical Center. What is colorectal cancer? Cancer in the colon itself. It's an abnormal growth in the colon that can continue to grow and spread and go to other areas. Everybody's at risk for colon cancer, but as we age, we become increasingly at risk.
And I just put it off probably being the prototypical male, not having any, issues, and didn't go to the doctor unless I was deathly sick.
Many patients don't have any symptoms at all. That's why we recommend routine screening, but certainly the symptoms that may be red flags would be bleeding with bowel movements, change in bowel habits, abdominal pains, cramps, things like that.
It's pretty easy just not to go if you're not having any real issues. So I went to the doctor because by the time my wife talked me into going for just a basic physical with your primary care physician. And I went there and talked to him, and after discussing a couple things and having some issues, they ran blood work, and he wanted me to see a colorectal surgeon based off a couple of other issues.
Brandon's situation was very unique in that he had actually a satellite growth of his cancer outside into the hemorrhoid tissue that was causing pain and bleeding. That was just a small representation of what was actually a bigger problem further up in the rectum.
I was at home, nobody else was there. I get the phone call around lunchtime, and I sat there and contemplated what to do. Do I call my wife and tell her over the phone, or do I wait for her to get home? Back then, my daughter was 19 and my son was 12 or 11, so I had to discuss with them and tell them that I had been diagnosed with cancer. That was probably the hardest thing I've ever done in my life, was tell my kids.
Colonoscopy happens to be the best thing that you can do in preventing colon cancer. Cologuard is something that'll screen for early detection of colon cancer, which of course is key to curing a colon cancer. If we can find the cancer early, we can most of the time cure it with an operation. In people that are completely asymptomatic and just wanting to get screened for good health maintenance and prevent colon cancer, colonoscopy is the way to go, because it will find the polyps in the colon before they've turned into a cancer and can most of the time be removed without letting them grow into a cancer.
I often wonder myself if I'd have went when I turned 50, which is in March of 2023, versus 6 months later when I was diagnosed, what would we have found that I only had maybe a mass in my colon and it hadn't gotten on my liver yet?
Right.
So it's very easy. I know nobody wants to do it because of the prep for the colonoscopy, but it is a very simple process and it can save your life.
Unfortunately, patients are often very nervous about getting colonoscopy. It's a violation to their private areas, and so it's unnerving for people, but screening with colonoscopy is the best way to screen.
So that was on Wednesday, and I got in to see him on Thursday, and I found out Friday at lunch that I had a colon cancer. The cancer in my colon metastasized to my liver, and we found that through a CT scan and MRI. I have received 8 chemo treatments during 2023, 2024, and then I went through 28 days of radiation of my rectum colon area, and then I did also during those 28 days, I did a 28-day cycle of chemo.
Wow. Well, Brandon, your strength is really inspiring, and I think it's going to be really inspiring to a lot of our viewers watching.
If you have any red flag symptoms, change in bowel habits, bleeding, it's important to reach out to your healthcare provider, your primary care physician. Eating a well-balanced, healthy diet, high in fiber, is the best thing that you can do for bowel health. The main thing with regard to knowing about colorectal cancer is get screened.